Hello future parents, midwife Ilenia here to talk all about the afterbirth. Let's start. Welcome back into this channel. This is the last video of the series all dedicated to labor and birth. I'm gonna put all the other videos in the description box down below. We left the other video with delivery of the birth of your baby. So your baby has just been born, and this determines the beginning of the afterbirth, which is a period of time that has a clear beginning, but it's never gonna end. It's gonna be with you for the rest of your life. However, I'm gonna put a little bit more of focus on what happens in the first hour or two after the birth of your baby. You're likely to be in the delivery room. You're gonna stay in the delivery room in this period because the midwife is gonna be there with you to check you and baby a bit more closely. She's gonna be maybe in and out to do some bureaucratic things, but you're gonna be monitored a little bit close in this hour to make sure there is no excessive bleeding and that your baby is doing all what he or she is required to do in this period of time. What is gonna happen? So when your baby is born, he or she is gonna be put straight away with your consent, skin to skin, onto your chest. This is the best place for baby to be soon after they're born. Maybe the midwife is gonna dry the baby a little bit just to prevent baby to get very cold. But beside that, baby is gonna be put chest to chest with you with a blanket or a towel on top of it. And this is the place where baby should be for the next hour or two without interruption. In fact, skin to skin has been proven to have so many benefits such as thermoregulation, in facilitate the initiation of breastfeeding, production of oxytocin for your baby, reduce stress for you and your baby, promotes bonding, and so many other benefits, and I could keep going forever. So while baby skin to skin with you, there are other things that are happening in the meantime. First of all, the cord has to be left intact. We refer to this practice as delayed cord clamping, meaning that the cord is gonna be left intact in order for the blood to be delivered from the placenta to the baby's body. I've done a full video on the delayed cord clamping, so make sure to check it out, but it's very important that baby's cord is left intact as much as possible, preferably until it stops pulsating or it turns white, meaning all the blood inside has been transferred to the baby. The cord is connected to the placenta. If you have never seen a placenta, this is kind of what it looks like. This is the baby part with the cord attached to it, and baby is gonna be connected to the cord. So baby is gonna be delivered and put skin to skin onto your chest while the cord is still attached. The placenta is gonna be left inside your uterus, so with the amniotic sac like this, and this is gonna be the maternal side attached to the uterine wall. And the placenta is gonna start to separate in order to be birthed as well. There are two different types of delivering the placenta. One is called the physiological management, and the other one the active management. With the physiological management, we simply sit and wait for the placenta to be born by itself, and this usually occurs by an hour. With the active management instead, after your baby is delivered, we give you an injection of oxytocin intramuscular, so usually in your thigh or in your butt cheek, to help the uterus contract more in order for the placenta to be delivered quickly. So usually with the active management, the midwife is also gonna put a little bit of traction into the cord in order to pull the placenta outside, and usually everything is complete by 15-20 minutes, but it can be also left and waited until an hour as well. We recommend to do active management when there are risk factors for bleeding. In fact, active management has been proven to reduce the percentage of hemorrhage, of postpartum hemorrhage. Situations such as induction of labor or a previous hemorrhage or anemia in pregnancy, they're all cases in which active management of the third stage is recommended because it really decreases your chance of bleeding. With the birth of the placenta, we concluded the third stage of labor, which is the period of time from the birth of your baby to the birth of the placenta. At the same time, though, so many things are still going on. We left the baby skin to skin with you. Now the cord has stopped pulsating and the placenta is born. There are so many things that your baby is still doing. Baby is still trying to adjust herself or himself to the outside world. Is starting to learn how to suck and latch to the breast, is still managing and understanding how to breathe and how to use the lungs. The circulation of baby's body has completely changed after the cord has stopped pulsating. So there are so many things that your baby is doing. With all these changes that baby's gonna do, baby's also gonna start to try to root for the breast in order to latch if you've chosen to breastfeeding. This process is really instinctively, and nature does it all by itself, and you're gonna be amazed to watch your baby knowing already how to do all these things by himself or herself in the first hour of birth. So if baby is left undisturbed, skin to skin, chest to chest with mom, baby's gonna start to kind of crawl to the breast. In fact, your areola and nipple are even darker, are even more brown during pregnancy in order to let baby to be able to see it. And also the skin and the ends, they smell like the amniotic fluid as well as your nipple and your colostrum. Therefore, baby's gonna be attracted to the nipple also by that. So you're gonna slowly start to see your baby crawl into the breast in order to latch. Not every baby is the same. A lot of parents are worried that baby doesn't latch in the next 5-10 minutes. Babies need time. They've just gone through a major changes, as I was saying, into their body. Plus they've done maybe a long labor, so they're tired as well. Some baby just need to chill a little bit and then they start to root and to look for the breast. So no pressure and let your baby do its own things. The golden hour, this is the name that is given to this period of time, is really a precious time that should be not interrupted by external checks or other things. Baby needs to be skin to skin with mom, no other skin to skin with other parents unless it's really indicated because mom needs to go somewhere because there is an emergency. Otherwise, baby needs to stay with mom as much as possible. We call it golden hour, but it really can be even longer than that, especially if your baby starts to feed and it feeds even longer than an hour. That's great. The first breastfeed is what sets all the other feeds and your breastfeeding journey basically. So it's so important that baby gets it right the first time and that is not interrupted by doing so, and that you just take as much time as you need with your baby to bond in this first hour or two. So baby suction reflex is gonna be absolutely at the highest level at this point. So baby's gonna suck, and it's never gonna stop. And a lot of mamas are worried that they don't have enough milk at this point. You don't need to have a lot of milk. There is colostrum in your breasts, and this is gonna be enough for baby in the first days of life. So make sure that baby is latched well. You can ask help for your midwife. She's gonna be there to help you with that. And baby needs to be left at the breast as long as she or he wants. This period of time is so precious. There is so much happening between you and your baby, hormones that are starting to flow and let you bond and to know your baby. Oxytocin and endorphins are overflowing your body, so let them do that. Just sit back, rest with your baby on your chest, maybe eat something if you're hungry or have some drinks, that's for sure, but for the rest of the time, just let your baby nurse and just fall in love with him or her, because it's a period of time that is never gonna come back and it's so precious. So all the checks and examinations should be delayed. Some checks can be done while baby is skin to skin with you, but for the rest you can wait. You can wait the golden hour to finish. You should also ask for delayed bath if your hospital doesn't do so. It's a practice that should be recommended. Babies don't need to be bathed straight away after birth. It's highly recommended to wait until 24 hours after birth. Babies are born with the vernix caseosa, which is this cheese-like substance that covers the skin, that helps them to thermoregulate, that helps protect their skin, helps them adapt to the extrauterine environment. So you should really let the vernix absorb itself while baby is skin to skin with you and avoid bathing baby unless it's really clinically necessary for some reasons. That's all for this video, which was the last one of the series, all dedicated to labor and birth. Make sure to check all the other videos related to the series if you have not done so already. Please like the video if you like it and don't forget to subscribe to the channel. Bye bye!